Thank you so much for having me today. RSDSA asked me to speak about patient advocacy. So I'm going to talk about the power of patient advocacy and specifically advocacy, legislative and policy related advocacy. Jerry, please, since I'm sharing my screen, I can't see you. So if I have any technical issues, please just go ahead and step in and let me know. I have about 40 minutes of a presentation, and then I'm hoping to leave the last 20 minutes for questions. But a little bit about the EveryLife Foundation for Rare Diseases. We're a nonprofit, nonpartisan organization located in Washington, D.C. And our real mission is to empower the rare disease patient community to advocate for legislation policy that will give patients access to life-saving diagnoses, treatments, and cures. So we don't speak for patients, provide training and education and resources and opportunities so that their voice can be heard. And specifically, I work on the RDLA team, the Rare Disease Legislative Advocates Program, and that's our main advocacy arm. And our main goals are to educate patient advocates about how legislation and policy impacts their lives, to build awareness on Capitol Hill and ensure that Congress is hearing directly from patients and caregivers, and to connect every member of Congress with a rare disease advocate. So when they're considering important legislation that's going to impact patients and their family members, they know that it's about a real person that they know and that they've met. I'm going to take a step back in time to the AIDS movement, which was such a historic and landmark example of patient advocacy. During this time, HIV patients were started this movement to be heard, to ensure that they would have access to treatments that save their lives. So activists were doing things across the country, including storming the FDA and laying down in front of the doors at FDA out in White Oak with tombstones, really making the point that FDA would be responsible if they didn't act to ensure that treatments were made available to patients with HIV. And due to this advocacy, FDA had created a whole new system for reviewing treatments called accelerated approval, which you might have heard in the news recently. And due to the accelerated approval, we saw the biggest surge in innovation, all due to this advocacy. So this is just a lesson that educated and active patients are effective and powerful change makers. Who are new to advocacy, really start by advocating for yourself, a loved one, a community. You find a reason to advocate. And so that can be educating your lawmakers about your experiences, or more specifically, advocating in order to solve a specific problem. So advocacy, the reason to advocate is because legislation impacts the healthcare for you and your loved ones. So whether that's getting a approved treatment through FDA, eliminating the diagnostic odyssey, improving the regulatory process, ensuring access to therapies as soon as possible, and countless other reasons. And as we start to talk about rare disease advocacy, it's important to note that rare diseases really aren't that rare. It can feel that way, especially when you're personally affected by a rare disease and maybe haven't met another person with your rare disease or a rare disease at all. But there are over 7,000 rare diseases and over 30 million people affected by rare disease states. So that's 1 in 10 people. And earlier this year, the EveryLife Foundation commissioned a study to study the economic burden of rare diseases. And through that study, out of 379 rare diseases that were included in the study, so 379 out of potentially 7,000 rare diseases, there was a 15.5 people estimated to have those rare diseases. So that 30 million number might be a lot lower than some of us expect. And also through that study, we found that patients spent an average of 6 years navigating through the rare disease diagnostic odyssey and visited almost 17 specialists from their first symptom with a rare disease before they actually received a diagnosis. So with that in mind, you have the power to affect change and to take an active role in the political process. There are so many ways to take a role and influence legislation and policy, whether that's voting, volunteering on a campaign, or meeting with your members of Congress and building a relationship with your elected officials. The decisions made by Congress and other decision makers has a real world impact on real patients. So it's important to get that message across. Key to success really is persistence. And I'm going to talk a little bit about how to be persistent a little bit later. But advocacy is not a one-time action or event. It's not just making one phone call or an email or meeting one time. It's really continuing to goal and building relationships in order to find solutions. And I know that advocacy can be a little intimidating, especially when it comes to our legislators here in Washington, D.C. But your legislators represent you. You vote for them. They're in Congress to represent you, and they really do want to hear from you. You're the constituent. When I was a Hill staffer, constituents love to remind me that I worked for them. In many ways, I did. So in addition, you're the expert on your rare disease experience. A member of Congress, their staff have no idea what it's like to live with a rare disease, the experiences that people living with rare diseases go through on a daily basis. So it's so important to share those experiences so that they can understand why it's so important to get those treatments and that diagnostic odyssey to have real world examples. These relationships are really important because they actually influence on the offices. This was a survey taken of congressional staffers a few years ago where it showed that those in-person visits with constituents made the most impact and influence. And I equate Zoom calls these days as in-person visits. And I like to show this slide of how a bill becomes a law because it shows all the different points at which an advocate can make a difference. We always say, don't wait until it's too late. And this kind of highlights how in each of these steps process, there's a point at which advocacy can take place. And so whether it's a bill that you're advocating for or against, from introduction all the way through the committee process till it ends up on the House floor, there are points at which your legislators need to hear from you. So once you've figured out that you want to advocate, how do you actually do it? There are many different tactics for advocacy, but really the advocacy is creating relationships with your state and federal legislators and sharing your story. And you can continue to build those relationships by asking questions, engaging with organizations like you're doing today, and supporting other rare disease patients, advocates with their policy goals when they align with yours. Like I said before, advocacy is not just a one-time thing. So part of that is also activating your own network because we all have family, friends, coworkers that are happy to help. So to get started, you want to figure out your goal for advocacy, problem that needs to be solved, determining what that problem is, or just wanting to share awareness and education about your disease. And to get started, engaging with your legislators, You'll want to determine what kind of issue your problem is. If it's a state issue, you're going to want to in state legislators. And if it's a federal issue, then you'll be talking to your federal representatives and senators. And you'll want to meet with the appropriate legislators to make sure that you're reaching the right people. So a great first step is just starting with your own legislators. And as the issue gains momentum, reaching out to legislators that happen to be on the committee of jurisdiction, like the Energy or the Senate Health Committee in the Senate. Never assume that any of these people that have understand the issues and problems that you're facing, because this might be the first time that they are hearing specifically your disease. So when to engage, anytime and all the time is great advice, because you just don't want to miss that opportunity to make your voice heard and for your legislator or other decision makers. Yeah. And then if it's a state issue, you'll really want to check your state's legislative calendar. All state legislatures have different calendars. Some do business every other year. Some do most of their business in the first half of the year. So just making sure that you know when your legislature will be in session, so you don't miss out on your chance that year. And no matter how you engage, you'll want to make it personal. But there are so many ways to engage. It's not just about meetings with your legislators, although that is one part of it, but there are lots of different ways to engage with offices. You can attend their own events that they're holding in the district or even online these days, such as town hall meetings. When she often would do like coffee hours at the local coffee house. But if writing is up your alley, you can write an op-ed or your story on, or reach out to your local media to share your story. So there's so many different ways to advocate for policy and legislation. If you are interested in scheduling a meeting with your legislators, it's really easy to schedule a meeting. I'm going to tell you the big secret on how to get that done. If you go to our website, to the Take Action page, you can find your officials by typing in your zip code and then your address, and then clicking on your legislator's name to see their phone number. When you call their office, you just let them know that you're a constituent where you live so that they can confirm that you are a constituent, and let them know that you want to schedule a meeting with the staffer that's responsible for the legislator's healthcare policy. Do that. Every office accepts meeting requests in different ways. It might be emailing the scheduler specific details, or maybe even over the phone. But it's really not as complicated as you might think it is. And once you've a meeting with your legislator, you'll have a little bit of homework before you meet with them. One of really advise is that you find ways to connect with your legislators. They're from your hometown or your home state, so there should be lots of ways to connect with them. You might root for the same college football team, or you might live in the same town, but also research them and find out what issues they're interested in and what legislation have they supported in the past that's in line with what them to do. And these are all really easy things to find by looking at their website or looking at their newsletter, their press releases. And we always say to remember where these issues are bipartisan. There's never any reason to talk about politics in these meetings. We're the rare party, and none of the issues about are controversial. And so to make sure that you're prepared for your meeting, I suggest you write down some bullet points, some key messages that you want to make sure to share. Create an elevator speech. You never know how much time you're going to have with the legislator, especially if you're meeting with the legislator themselves. But so you kind of want to have, different versions of your speech, right? You want that quick elevator speech that you can fit in if you're going to meet them at a town hall meeting or squeeze in a picture opportunity at their office, or even, I've seen congressmen, especially now that we're over Zoom, like pop in on their staffers' Zoom calls for a minute or two between their meetings, or, in the middle of a committee hearing. So having that 60 to 90-second elevator speech is super beneficial. And then have your supporting materials. We call them one-pagers, because legislators and congressional staff don't have long attention spans. So if you can get your issue across on one page, that will be super. So putting the background down of what that problem is, what the solution is, and how it impacts your community, both your state, local community, as well as your disease community. And then how to tell your story. There are definitely lots of advice out there on how to tell your story, especially your patient story. And this is really advice for those who do want to meet with their Congress people, but super applicable to if you want to share your story on social media or with the local media. But first, you want to start with what the problem is when you're telling your story. So, some of the problems that we've outlined already today is, accessing diagnostics or treatment. It might be a problem with Medicare or Medicaid. It might be an issue that you're having with your health insurance on covering certain treatments. Those are problems that legislators need to hear about. And when you're telling your story, it's even better if you can give them what the solution is. So if there is already a bill out there that addresses the problem that you're talking about, talk to them about what that bill is, what it does, and how it would help you. And if there isn't a bill, if you do have a thought on how the problem could be solved, what does CMS need to do in order to make sure that you have coverage for your treatment? Let them know, because there are many members of Congress who meet with their constituents and introduce a bill because there isn't already an existing bill out there that will address that specific problem. And then have a call to action. So we call that the ask many times, and you want to be as specific as possible. Because they want to, in general, your member of Congress is going to want to make you happy. They're going to want to help you, and they're going to want to do what you ask if they can. So being as specific as possible so that there's a question to them about what they're supposed to do after they meet with you. If you're not specific, they might leave that meeting thinking, oh, it was so great to meet them. I hope we can help them. But I'm not really sure how I'm supposed to help them. So being as specific as possible. If it is a specific bill that you want them to co-sponsor or vote for, tell them, please co-sponsor HR 5, because this is what's going to help me, or signing on to a letter, being as specific as possible and outlining it for them about what it is that you would like them to do. And then legislators do have some expectations when they're meeting with their constituents. They have limited time. Their staffers in DC are pretty busy as well. If you have an opportunity to meet with them in their district or state offices, they generally have more time. They're not as rushed to get from meeting to meeting or place to place. So it's definitely a more relaxed atmosphere. And usually you get a little bit more time with their office as well. But you want to be as informative, compelling, and concise as possible. Like I was saying, being clear about what the problem is and the solution and what you want them to do. And just make sure you have a sense of what their views, platforms are. If your senator has already said that they're against expansion of Medicaid, just that doesn't mean that you should ask them to expand Medicaid. It just means that you should know that they've already said that that's not a view that they support. And so that when you go in, you're armed with the information that you need to and can be as respectful as possible. And of course, show how that problem applies to you and to other constituents, and be I was talking about. And of course, remember, like, you're the expert. They want to hear from you, and try to be as natural as possible. Don't memorize your speech. Don't read from a piece of paper. Try and make it conversational. Try and make it authentic as possible, so that you're making a real connection with them. And then I would love to share this video of Yash website. I think if I play it, you guys will be able to hear it.
My name is Yash Krishnan, and I'm a resident of Cary, North Carolina. I'd like to use our time today regarding supporting research in new medicine. The reason why I'm advocating for this is because it's called CMMRD. I am the only person in the world with my genetic mutation. My disease has no cure, which is why I get a lot of treatment. My sister also had many rare diseases with no cure and passed away. I know you can help by supporting the STAT Act for supporting research in new medicines. What you may not know is that there is very little funding to support pediatric cancer and rare diseases. I would like to ask again what the STAT Act, because it's saving my life and benefiting many other people. I matter. We, as a rare disease community, matter.
Awesome. So that was Yash and talking about the STAT Act. But that was 49 seconds, and it's of introducing yourself, outlining the problem, and then giving them the solution and the call to action, which is co-sponsoring the STAT Act. And then social media is such a powerful tool for advocacy. Facebook, Twitter, Instagram. Advocacy can take place on pretty much any social media platform there is. And most members of Congress have their own Twitter and Facebook accounts too. So you can tag them in your posts, make them aware of problems that you're facing, and then also use it to thank them for actions that they take, or if they meet with you, thanking them on meeting with you, posting a photo along with your post and tagging the member. It's so nice for a member to be thanked and to get some positive reinforcement, and that can just help to further build that relationship with that office too. And if the member of Congress isn't active on social media themselves, they certainly do have staff people that are running the social media accounts. So someone is paying attention. So like I said at the beginning, advocacy really takes persistence. So following up, continuing to build those relationships with your legislators. And we know that things come up. We're all busy with work and kids or just taking care. So it's totally understandable when sometimes we need to take a break from advocacy and other things to concentrate on those. But with a specific goal in mind, persistence is really necessary. So continuing to thank the member and staffer after they meet with you with an email or letter and social media. And then, checking in with those members and staffers too. If there's a change in your situation, letting them know about any changes, or if there is action on a certain bill that you support or oppose, letting them know, just keeping in contact. We don't want to be annoying to the office, right? Like we're not emailing the staffer every week or every day, but, you know, every few weeks, you know, after a month or two, like checking back in, especially if that member hasn't signed on and co-sponsored that bill that you've asked for, you know, continue to check in on them and see, you know, what the holdup is totally warranted. And then just continuing to stay engaged and paying attention to that member and what they're doing. So you can easily do that by like signing up for the members newsletter on their website or following them on social media, and keep your eye out for opportunities to engage with the member in person. Walking up to them at an event, shaking their hand, introducing yourself can go a long way. And then call when you do see action alerts on legislation. Call the member's office and make sure to voice your opinions about it. And then if they do co-sponsor or vote for, ask him or her to support, make sure you thank them. They don't hear thank you very often. And sometimes those offices, a thank you can really stand out. And staff for these legislators are such a great resource. If you're meeting with someone who looks very young, don't discount that person. Staffers for members of Congress are young. The hours are long and the pay isn't great. And so that's who is working for members of Congress. So make sure to treat them with respect, stay in touch with them. They are great resources. They have the ears of their member of Congress, and they're really the gatekeepers. You have to convince that staffer that your issue is important before they'll take it to their boss, the member of Congress. So having a good relationship with the staff goes a long way. So if this all sounds really interesting to you and you want to be an advocate, I know that RSDSA foot more advocacy, and hopefully we'll be able to provide them with some resources as they get going. But I'd love to offer RDLA as a resource to all. You can sign up to receive our newsletters, monthly alerts, and invitations to our monthly webinars. So through RDLA, keep you informed on key policy issues. We host webinars. They're usually the third Thursday of the month, and they highlight state and federal legislation that impacts the rare disease community. That's really current and timely. Just last week, we held a webinar on drug pricing efforts in Congress that are happening right now. And then our website serves as a legislative clearinghouse. You can find action alerts, you can find resources and tools to help with your advocacy, such as tip sheets on how-tos for advocacy, policy primers on important policy issues that face the rare disease community, and educational videos. And we also have a state advocacy hub. If you're really interested in state advocacy, you should check out your state page on our state advocacy hub to learn more about how to level. And then we would love to have you join our Rare Disease Week on Capitol Hill event. It'll be happening virtually February 22nd to March 2nd, 2022. This will be our second year Rare Disease Week virtually, and we're doing so just to keep our community as safe as possible. We're looking forward to returning to in-person here in DC, but made this choice just to make sure that we were as safe as possible in 2022. But this is a great opportunity to attend our legislative conference and learn more about legislation. And we schedule meetings for you to meet with your legislators and their staffers via Zoom here in Washington, D.C. So this is a great risk-free, low-cost opportunity to attend Rare Disease Week on Capitol Hill while it's still virtual. And then I just want to share that we have another program called Rare Across. in August. So in August 2022, we'll be hosting Rare Across America. And this is an opportunity to meet with your legislators in their district and state offices. This was virtual in 2021, but we're hoping that we'll be able to do it in person in 2022, since it'll be later in August. And again, this is something where we schedule the meetings for you. So we try and make it as easy as possible for everyone to participate. And if you adult or know of other young adults who are interested in advocacy, I highly recommend our program called YAR, Young Adult Representatives of RDLA. They are a wonderful group to 30, and they don't just advocate. It's a program to instill confidence in the next generation of rare disease advocates by skill building opportunities throughout the year. So there's a speakers bureau where advocates learn skills for public speaking, apply it through different public speaking. For instance, it is a math-based program and accepts applications year round. So if you're interested in learning more or in applying more information and an application on the website at hearusyar.org. And up to questions, but if anyone thinks of anything tonight, feel free to reach out to me. My email address is at the bottom. Shannon von Felden. My email address is SVonFelden@EveryLife Foundation.org. And again, you can sign up for our newsletters and action letters at rareadvocates.org or find us on Facebook and Twitter and Instagram. So I'm going to stop sharing my screen now so I can see people. But feel free. Jerry, if you want to share any questions.
Hi, Shannon. I have a few questions. We don't have this share. We ask that people put the questions in the chat, and then but I have a few. So I just want to clarify, when you say meet the local and just yours, I just want to clarify for people in case they don't realize, every legislator has an office in the district that they represent. And like in my where I used to live, it was around the corner. And sometimes they're informal and sometimes they're formal. That's a more relaxed place to have a meeting, correct?
Yes, very much so. Yeah.
Okay.
Yeah, and they have staff there. So usually, they DC and they have their district staff in their district office. Sometimes they'll district office, depending on how big their district is. And those district staffers, usually, there's a lot of case managers, so they're very helpful if you have issues. For instance, if you need to pass really fast, call your district office. That is a service people don't realize that your Congress provide, or if you're having issues getting your veterans benefits or getting coverage through Medicare, your district office is really helpful for those things too.
Yeah, no, I like that. I just wanted to clarify that these offices will be in your neighborhood or your area, and so that you don't have to travel to Washington, and you might be able to do online meeting, or in-person meetings as things get better, hopefully. And then the other thing I want to say is the 90-second elevator speech. I find with something like RSDSA, just saying reflex sympathetic dystrophy, that can take up our whole 90 minutes. Do you have any recommendations to how to get around something like that? I mean, because they haven't heard of CRPS, complex regional pain syndrome, and they haven't heard of our organization. So what do you suggest when you have to fit it into 90 minutes? 90 seconds.
Yeah, I totally understand. There's a lot of long names when it comes to rare diseases and complicated explanations. of the disease. I think that's where making with materials is really important, so that you can give like a quick sentence about your disease. Of this disease, and it causes me a lot of and makes it disabled. And then you can give other information so that they can read up on what the causes are, all of this to your disease. But that way you don't have to go into the whole spiel about your disease in the 90 seconds. And then if you can always go into more information, right? So having that 90 seconds, if you need it on hand, time, might even ask you a question about like, can you go into more detail about your disease, understand it better? And then you can do that with more time. But you just never know, especially if you're being see how much time people will have in the offices. They generally have a little bit more time because they're not running from committee hearings to briefings to meeting to meeting. So it's in the district office for sure.
Okay, well, first of all, I didn't get to say thank you. It was a wonderful presentation. I'm seeing the comments on the side, and people agree that they feel it was very informative, Shannon, and I thank you for the slides. I wanted to ask two more things. Where is the update on the STAT Act? Now, people, this is the speeding therapy access today. And that's, I know I was part of the virtual week last February, and that is one of our asks. So I'd like to know, do you have an update on it?
Oh boy, I should have come prepared for that. Yeah, as Gary had said, we introduced this Therapy Access Today Act right before Rare Disease Knows Rare Across America earlier this year. And so we're still getting more co-sponsors on it. We're still talking to members of Congress, especially as conversation, the Prescription Drug User Fee Act, that gets reauthorized every 5 years. And so with that bill, there gets to be a lot of riders that get put onto the PDUFA bill. And so that'll be reauthorized next year in 2022. So there are a lot of organizations out there like ours who are to add on other issues, solutions that are, regulatory focused, which Speeding Therapy Access Today Act, some of those components might be applicable in that way.
Okay. Well, that answers what you're working on. What is Rare Disease Legislative Advocates working on right now? What are their asks right now?
Yeah, so Rare Disease Legislative Advocates, we really are a program to support the community. So the EveryLife Foundation for Rare Diseases has an entity called the Community Congress, which is our way to EveryLife on specific policy issues in different policy areas. But RDLA gets to work with organizations like yours and others goals. So we really try and provide a platform for organizations and advocates to be able to be educated, to know how to use their patient advocacy power, to share their message and to garner more support. So we work with several different organizations on their policy. And so, we're really a resource. You might notice if you sign up for our newsletter, we share a lot of different action alerts. And so that's one of the great things about my position with RDLA is how many different organizations I get to work with.
Yes, we're putting together what we call Protective Patient Task Force that is going to work to modify the opiate guidelines because they don't take into account for patients that opiates help and are not addicts, and just assume or assign all all people using opiates or addicts. And we want to make that distinction and explain that for people with chronic pain, those guidelines are hurting the community. And so that is what the advocacy committee of RSDSA is taking up at the moment. I also want to let people know that on our advocacy page, we are going to have that resource where you type in your zip code and your legislator comes up, so they can look for it there too. It's not there yet, but it's coming. And yeah, so that's one of the things. Oh, and we also noticed, because of what we've learned from at EveryLife in your group, that there are rare disease councils and committees in different states. And I wanted to let our community know that we've had success. We have a person representing the CRPS community on the Rare Disease Council in Florida. And that was really great that she got appointed to the council. So that was something else we had looked at based on the information on your site. Thank you.
Great. Yeah. And if you're interested in the Rare Disease Advisory Council in your state, we actually have at state advocacy.
Right. And you also have listed which states don't have them. So if you live in a state that doesn't have a council, that can be your issue. You can advocate to have a rare disease council. I am putting out a request for any questions, Shannon. But here let's see. If you're okay, if you're afraid of retribution, for example, workers' comp, are there anonymous ways to still advocate for your cause or gain an audience without risking your coverage under that program?
That is a good question. I'm not sure. I know that when you're especially talking to your legislators, they want to know who they're talking to. They're always super cautious and want to protect them. And so that can certainly be difficult if you want to remain anonymous. I'm happy to look more into that. Would like to get in touch with me. I'm happy if there are any solutions for that.
Thank you, Shannon. I have one other question. In sharing your story, how much do you want to tell? How much do they want to know? What is too much?
Yeah, that's it's kind of a fine line, I must admit, between, and what's too much. I think, paying attention to make sure that they're comfortable with the conversation. You're going to most likely be talking to a healthcare staffer, and, with their job. And so, you won't be the first person to cry in a meeting if, it happens, all the time. So you shouldn't feel embarrassed or upset if that happens. But I think, I think it's more important just to stay on task, right? Like making sure that the information you're sharing is necessary information, right? Like how that's applicable to what your problem is and the solution that you need. So I think it's just kind of staying on task with your message and making sure that you're not, going down different rabbit holes. I think that's where things can probably get a little bit messy in a meeting, is when you start to trail and it all for the staffer to follow, and then they're really sure what exactly the problem is if you're telling them things, and it's hard for them to follow. I would be afraid of sharing too much information. I would just want to make sure that the information you're sharing is very story and for like your message and how.
And if you do in-person visits, always follow up. I know that. And I wouldn't worry about crying. I used to work it for hemophilia, and I always cried when we visited legislators, particularly if people brought their children. And
Yeah,
we
I
always
mean,
came with visual aid.
Yeah,
we would show
heavy
like
stories.
the medicine.
Mhm.
We would go with visual aids, like we'd bring a package of the medicine and tell the legislator just how much this cost out of pocket, so that they would understand, you know, what it means to live like.
Mhm.
Okay. Somebody asked, when emailing our representatives, will we get a response? They once did, and they didn't get one. So
Yeah, so each legislator actually has a person who's dedicated to answering mail. That was my job many years ago, was answering all the letters and emails that the Congresswoman received. And so a lot of times you'll get a form letter, which is, if you're going to write in about Medicare, for instance, then you're going to get the Medicare form letter that outlines, the member of Congress's stance on Medicare. Or, if you're going to write about the Build Better Act, you're going to get the Build Back Better Act letter from that member of Congress. So for the most part, response, I'm surprised if you didn't. One thing too, like if you're emailing the member of Congress, then you might want to call the office and ask them, who is the healthcare LA, and get. Sometimes you can find them online. It's kind of public information. And email the staffer your email. Say, I tried to email the senator and I never got a response, and I just want to share this with you, aware of this issue.
Okay, and I do have another question. Is it a conflict of interest to get involved in advocacy as a practitioner?
Not at all. So I know we talk a lot about patients and family members and caregivers, but really the more people that join in advocacy for the rare disease community, the better it is for all of us. I think that, even your friends have such a valuable viewpoint to share for advocacy. Medical professionals and researchers have a really important point of view to share with legislators about to be treating rare disease patients. What are the barriers of care? Why is it taking so long for patients to get diagnosed? I think that that's really important information, and a very credible source for legislators to hear from too. So I would encourage, if there are any medical professionals in your who want to be advocating, I would definitely be encouraging them to do so.
Thank you. Okay, we have, that is the questions that we got from the audience. We do have 10 more minutes if anybody else has some more questions for Shannon.
Wonderful.
If you, I don't know, you can see the chat, Shannon. You can see that. Yes. We're all very pleased with this. Is all very, very helpful. And I just want to reassure people that advocating isn't really that scary, and that most of you do it already. Every time you talk to your doctor or your nurse, or you go to the emergency room and you have to stand up for yourself, that's all advocating.
Yeah. I mean, I think that it just seems very, very overwhelming and intimidating, especially, in so many cases, advocating it has meant, flying to Washington, D.C. to meet at the Capitol. That's certainly been changing since the pandemic, and will probably continue to be changing in the near future, especially as so many patients got advocate over the last year and a half. We didn't have that opportunity due to either cost or physical abilities. So I think that there will be some form of virtual advocacy staying in our lives. So hopefully more people can advocate. And I really appreciate you having me, Jerry. And I should say that was my daughter off to bed, but she was showing her Halloween costume. She's going to be a ballerina.
Oh, okay. Because somebody mentioned in the background, what a little cutie, and I miss the cutie.
Yeah. She was jumping on my bed and then showing us her costume.
Okay. So yes, no, people are there. That's very nice. I know. No, thank you for this. And I have to tell you, people, I have signed up, and they, EveryLife and the RDLA, they do trainings, and you're in there with other rare diseases, and you talk with each other to, if there's going to be more than one of you in the meeting, and you can include sometimes. And sometimes our issues and our asks align, and sometimes we have our own asks, but there's always room, I have to say, in your sessions to add our asks as a one pager in addition to the asks that we're making for all rare disease. So we really appreciate that.
I think that's something pretty unique to, is that we want it to be an event for the community. And we know that so many different organizations are working on so many different things. So we want to make sure that everyone is able to come and learn and participate during Rare Disease Week. So yes, we try and allow all asks Rare Disease Week as long as they apply. This isn't a real issue. So anyone has about Rare Disease, get in touch with me. I'm happy to answer questions people have about it.
Yeah, we will post. We'll put out there probably we have a digital newsletter every month, and when you open it up to sign up for it, and when the deadline is, we'll put that in our newsletter so that people are aware, and with a link so that they can sign up.
Great.
Okay. All right. Jenna, that's very true. We're all talking about it's a club that nobody wants to join, but you're okay.
I mean,
any final words?
I was just going to say that, I think that's one of the best parts about Rare Disease Week, though, is when you bring together so many different people from so many different rare disease communities all together, is you really feel like part of a large community, and know that it's not just having these experiences or your community that's dealing with certain issues and problems. And so I think that it can be such an empowering, especially for patients, to get to experience that.
Yes, thank you. All right, everybody, it's going to be time. Yes, in 5 minutes, you can network again. I'll do my little plugs. The auction is closing tonight. So if you, and I think there were at least 7 items that had no bids. So those might be the bargains to be snapped up. And one last time, we're doing a painting. It's one of those, it's paint, a paint night with Color the World one brush at a time. It's going to be virtual. You can sign up. It does have a fee. And we will mail you the supplies that you will need to join: a canvas and paint. And that is November 7th. So sign up for that. If you're interested, that sign up will close tomorrow. Thank you. And Color the World Orange, that's our special, November is CRPS Awareness Month, Shannon. So and Color the World Orange is Monday, November 1st, and we encourage everyone to wear orange and take photos. You'll see buildings lit up across the country in orange.
Very cool.
So that's coming up for all of us on Monday. Thank you
so much for having me. Have a good night.
You too. Good night.